Hello, everybody. Tashina here. It is a little bit late, but I'm up, pretty alert and awake. So I thought I'd come on here and give you guys like a little bit of a longer update. So as you come in, as usual, give me a wave, a hi, hello. Let me know what city, state, or country you're watching me from, and hashtag replay if you're watching the replay. So if you've been following me, you know that May was a rough month for me. We had a couple of deaths in my family. I got rear-ended, and then I ended the month with a surgery that was obviously on the books for 6 to 8 weeks, and had been discussing it for months prior to that. So I thought I would come on here and for those of you that don't know the details of the surgery, just chat a little bit about that. I'll probably come back and tell you what I'm doing as I'm recovering. But it's been about a week and a half. I'd say I feel like I'm at maybe 45%, which is, weird for me, a person that's always high energy, moving, go, 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 go. The hardest part for me right now is that my energy levels are so low. So I'll do a couple things. Like today I had physical therapy, had a 2 o'clock appointment, and I'll come home and I'll be like, oh, I feel really productive, but I'm a little bit tired. Let me take a nap for an hour and a half. And then I'll stay in bed for 2.5, 3 hours. And then I'll get up and I'll be like, oh, that didn't really recharge all of my batteries, and I won't get as much done as I thought I was going to. So that's probably the biggest thing. But so just to backtrack a little bit, so I suffered through fibroids from 2012 to 2014, and I didn't have any holistic support and solutions. And so at that point in time, I had to have, let me look at this because I got to look at the official name. In March of 2015, I had a hysteroscopic myomectomy to get rid of those fibroids. In January prior to that, thankfully, I got dialed into some holistic solutions. I was taking my Floretics and Ninja Red, so I got my iron levels and my hemoglobin where it needed to be. I had some other natural support, and so that is the least invasive type of the surgery to remove fibroids. And I was out of the bed in 5 days with that one and back to work in a week. But I wasn't dealing with an accident on top of it. So just for information, and yeah, I know I got some men here, but you might need this for your wife, girlfriend, sister, aunt. My mom had this surgery, and she had 8 weeks of recovery. One of my workmates, she also had it, 6 weeks recovery for her. And, the first time that I went through everything I was going through, it was I felt embarrassed. I wasn't talking about it. And then when I had surgery, people were like, I didn't even know you were sick. And then find out that so many other people were suffering. So this time around, I'm like, I'm going to talk about it, right? So for context, myomectomy is a surgery in which a non-cancerous fibroid myoma is removed from the uterus. Myomas are tumors made of fibrous tissue, and I'm reading this right from the stuff that they gave me from Henry Ford Health. That's I got 12 pages of info and recovery stuff. They're often called fibroid tumors. Fibroid tumors can range from the size of a pea to the size of a grapefruit. In a myomectomy, the fibroid tumor is removed without removing the uterus. Because these tumors are rarely cancerous, the surgery is usually done only if the tumor is growing and causing symptoms such as pain, pressure, bleeding, or pain with intercourse. So the first time around, I had all of the above. Thankfully, this time I was thriving through fibroids. I actually didn't have any pain on a regular basis. I didn't have any extra bleeding except for when I was on the time of my month, and that's when it was unbearable and I could barely leave my house. And that's why we had the surgery, because we tried so many other things to deal with it, and it wasn't. She was like, get the location, what's going on, this is gonna be the only way. And so I had my follow-up. Everything is good, wonderful, amazing. So she removed a fibroid that was the size of an orange, she said, plus 8 other ones, and she removed everything that she saw. So the surgery was successful. So that's super, super good. So what are the risks of a myomectomy? Generally, it's a safe procedure, but problems can occur with bleeding, infection, allergic reactions to medicines, damage to other structures or organs, blood clots in the legs, chest, or pain, scar tissue on the other organs or in the pelvis. So thankfully I had no complications. There was no extra bleeding. If you guys know details about me, I don't accept blood transfusions. So they had a cell saver available. They didn't need to use it. So I didn't have excessive bleeding. After the surgery, I really didn't have any excessive bleeding either. So yeah, everything's all good. She checked out what my scars looked like. There was no infections. That was all good as well. So this time around, what I had was a laparoscopic myomectomy. And so that, let me read to you what that actually is. So that says a few small incisions will be made in the lower abdomen. Thin light tube with a camera, laparoscope, will be inserted through one of the incisions. This will give the surgeon a good view of the area. Fibroid tumor will be removed through the other incisions. The incisions will be closed with stitches or sutures or staples. So that's what I actually had done. So like right now, I have like 4 incisions. The bottom one is on my belly button. That's the one that bothers me the most. It keeps feeling like it's opening and then pussing a little bit, and then she said it's fine. I just have to keep it clean, and yeah, it's all good. It's not infected, so it's all good. So some of the general stuff about aftercare, what to expect: pain in your abdomen, especially in the incision areas. And you will be given pain medicine to control the pain. So again, I'll probably do another live where I talk about like what they suggested to help me, and some of the other natural stuff that I'm using as well. Tiredness is a normal part of your recovery process. Your energy level will return to normal over the coming weeks. Which again, like this is the thing with me. I'm like, I feel exhausted. I feel tired. This is so weird. Vaginal bleeding, this is normal, will stop in the coming weeks. For me, it stopped within 24 hours. Constipation, not too bad. I mean, I do all my stuff for having amazing gut health. Medicines, they give you over-counter and prescription. Again, I'll go over that later. Making sure that I wash my hands with soap and water before changing bandage. Changing dressing is told by my healthcare provider. Leaving stitches or sutures, skin glue, and adhesive strips in place. That was left in place until I went to the doctor yesterday, and she like kind of rubbed some of that away. So I was good to remove those. And then to be aware if there was redness, swelling, plain blood, warmth, pus, or bad smell. I don't have any excessive. She said it was okay with that. Activity. Do not do activities that require a lot of effort until your healthcare provider says it's okay. Do not lift anything that's heavier than 15 pounds until your health provider says it's safe. Walk daily, but take frequent rest breaks if you tire easily. Continue to practice deep breathing and coughing. If it hurts to cough, try holding a pillow against your belly as you cough. So that's one of the things that, yeah, I have some congestion that will come up. And I've been using like my thieves chest rub for sure, and some other soothing things, and making sure I'm doing my mindfulness and my deep breathing and stuff like that. I need to drink enough fluid to keep my urine clear and pale and yellow. Take over-counter and prescription medicines as needed. Eat foods high in fiber, such as fresh fruits and vegetables, whole grains and beans. Limit foods that are high in fat, processed sugars, such as fried and sweet foods. So if you guys were following me on Facebook, you know I didn't have an appetite for a while, and I just went with that. I'm feeling pretty close to normal now, so that's good. Summary: recovery time for this procedure will depend on the type of procedure you had and your general overall health prior to the procedure. If you were prescribed an antibiotic medicine as told by your healthcare provider, do not stop using that. Return to your normal activities as told by your healthcare provider. Ask your healthcare provider what activities are safe for you. So again, one of the things that's affecting my overall health is the fact that I was rear-ended 2.5 weeks prior to this. And so I think that definitely is affecting it. I started physical therapy this week. I also, because it's a motor vehicle accident, will be able to get a massage and acupuncture. So I'm super excited about that. I didn't have any appointments this week, and I'm actually going to be traveling. So my doctor approved for me to be off work, off of my day job for 3 weeks. So I think I get like 7 days, 6 days, and then it converts over to short-term disability. So I am on short-term disability until June 20th. And then she said it was okay for me to travel, because y'all know my schedule we booked, y'all. But she also provided me a letter that I can request disability assistance if necessary. So, like, I'm not always walking the right speed because I have back issues and stomach issues at the same time right now. So and then I booked January 10th. I booked to go to Salt Lake City next week, right? Salt Lake City has higher elevation, so I don't currently suffer from asthma, but I had it in the past. And the first time that I went to Salt Lake City, I had a really, really hard time. As having a history of asthma, the elevation does affect me. So with me already having low energy levels and having to deal with the back pain from the accident, it's quite possible that my energy could get really low while I'm there. So I'll have this letter where if I need to rent a scooter or be in a wheelchair for a little bit because my energy doesn't allow me to deal with the heat and the elevation, then I'll be able to do that. And the good thing too, like, I hated the past 2 years for Young Living. We had to have virtual conventions, but those are still in existence, right? So I can go there and say, I go to the farm on Wednesday and then I feel exhausted and I just can't get out of bed on Thursday. I could just go, watch it virtually there from my hotel or as much time as I need to and only show up when I need to and then do my thing on Friday and again recover on Saturday. So that's going to be really good as well. So it's a vacation and I will be vacationing and I will be resting. I will be listening to what my doctor tells me. So that is where I am, still staying busy. Outside of that, I actually am doing Michigan Fashion Week Friday. So I'll be at Eastern Market for that. And then I'm going from Salt Lake City to New York in order to participate in NFT NYC. And we have a digital fashion event Sunday the 19th that I'm supporting. So, but again, throughout all the process, we will be following the doctor's orders and we will be making sure that we are listening to what our body says and resting every time that we need to. So, let me know how you guys are doing. Like I said, I'll probably do 1 or 2 more lives with more details of how I'm recovering. But this is an update of where I am right now. I'm thankful that I do have the ability to have the time off work and just being a patient and applying my word of the year surrender to whatever is happening. Because again, I think that, things are going a lot more slow just because I had surgery on a weakened body because of the accident. And so just got to be patient and move forward. And yeah, I'm looking forward to whoever I'm going to see in Salt Lake City. Looking forward to whoever I'm going to see when I'm in New York. And definitely let me know how you guys are doing. Don't forget to say hi and tell me how you are in the comments. All right. Thank you guys. Bye.